Greetings, one and all. We are delighted to welcome you one more time for this second webinar of our series. Like the first webinar, we shall be focusing on empathy and compassion elements as a lever for success and durability of social and behavior change. Today, we're going to focus on community engagement. The title is how can we create the the confidence and in for communities and create permanent service support to reproductive health and family planning services. Today we're going to go beyond this question. We're going to learn from experiences on malaria and maternal health. But more than anything else, we are going to see the important part played by active listening in community engagement and how it contributes to the tangible, measurable results of our activities. From Cameroon to Côte d'Ivoire, through Niger and Togo, we will find the tricks of the trades of these approaches, meaning the secret ingredients, so to speak, to reproduce these approaches in your countries. Today, speakers will be speaking in French. Therefore, I would like to invite you to choose the language channel you need as indicated on the slide. This is the agenda for today. We have several presentations on the approaches selected by the Breakthrough Action Project. And then we're going to make time for a question and answer session. So looking at a more detailed agenda, we will first have a summary presentation on the community engagement approach of the Breakthrough Action Project in West Africa, WABA, with examples of what has been accomplished in Togo. You'll see how we were able to implement positive changes to improve quality and use of reproductive health and family planning services. Then we will move to a roundtable on the various community engagement approaches used in other parts of Africa. And I believe that you will be following with great interest the manner in which these four countries have done similar things, but stressing different elements according to the local context. In Cameroon, for instance, we will see how we can involve traditional leaders in community health. In Côte d'Ivoire, we will see how women in the community bring other women from their neighborhoods and pregnant women to implement the keep family care practices and go to the centers that provide prenatal counseling. And in Niger, we'll see how to simplify the engagement of the communities through community action. Then we'll go through the question and answers, and I would like you to start asking vos questions in the chat window as things go. It is a privilege for me to introduce the colleagues who will be discussing with us the issue of community engagement. My name is Hilaire Tokplo. I am a regional advisor in social and behavioral change for the Breakthrough Action Project in West Africa. Let me introduce Valerie William Awama. She is coordinator for PMI in Cameroon. We will also have Benjamin Soro, the Deputy Director of Breakthrough Action in Côte d'Ivoire, Souley Abdulaziz Tanko, who is the Field Coordinator in Niger, and Telesfor Kabore, who is the Senior Advisor in Community Health for the Breakthrough Action Project. It is also a pleasure for me to introduce our partner, the Togolese Health Ministry, the focal point for reproductive health and family planning in the Blita Health District, Madame José Apeke, who is also with us for this webinar. So as I was saying, we're delighted to see so many of you on this webinar, and we would like to wish you a great webinar and supported attention until the end. But before starting to deal with the various community engagement approaches, allow me to remind you that the webinar is organized in the framework of the results of the Breakthrough Action Project in West Africa, which we refer to as WABA. The WABA project is funded by the Regional Bureau for Health of USAID in West Africa for the period July 2018 to December 2023. The global objective of the project is to provide access to modern family planning, and it's informed and voluntary use in Burkina Faso, Cote d'Ivoire, Niger, and Togo. In the framework of the activities of the project, we've developed a number of strategies. One of them requires implying the communities around the family planning in order to improve knowledge, attitudes, standards, acceptance of family planning, and the use of their services. So what is community engagement? Why is it important to resort to such a strategy for health issues? As you well know, the stakes and challenges in the health field become complex. They take multiple shapes, and the resolution of health issues go often beyond today the skills and the scope of intervention of the sole health agents, whatever the level. So community engagement approaches allow us to bring the stakeholders together to discuss on common topics of common interest, create spaces, fora for open and candid discussion, define together needs and challenges, and work to find appropriate solutions, ensure quality care, and work for a community individualization and autonomy. So what is the community engagement approach by the WABA project? The community engagement approach implemented through the WABA project includes three main intervention axes. First, we have community dialogues. Then we have guided visits in the health training and implementation of follow-up committee on the actions realized in order to contribute to improve the quality of reproductive health and family planning services. These are the activities of this three-stage process that I'm going to introduce in a more detailed fashion during my presentation.
So as I was saying, the first step is to organize community dialogues. Community dialogues are meetings or forums that are organized within a given community. They bring together around 100 people from all different socio-professional categories. Community dialogues create a space for triggering social and individual reflection, and in order to improve health outcomes within communities. Discussions are held on a specific topic in separate groups of health workers on one hand and community representatives on the other. The two groups then come back together for plenary discussions. This group discussion helps to identify and prioritize the main obstacles and challenges to the use of FP services. And they also help to define the actions to be taken to resolve these issues. At the end of the dialogue, referral vouchers are distributed to participants so that they can share these with people in their immediate environment. For example, this can be relatives, neighbors, etc., people who are in need of family planning services. And I would like to emphasize that these vouchers are used to assess the effectiveness of the strategy, and they do not provide any free services. The next aspect of this approach is the organization of guided site visits. A guided site visit is a complementary and very important activity that follows community dialogue. This is a way to highlight once again the problems and challenges that came up during community dialogue. About 30 community leaders take part in these visits, including leaders, representatives of organizations and administrative departments, and state governments. During the activity, participants tour the health facility under the guidance of a health facility manager. They may stop for short chats with midwives or to talk about PFSR questions. This is a unique opportunity for leaders to understand how family planning methods work, how reproductive health services are organized, and to better understand the benefits and the interest of family planning for families and for the community as a whole. At the end of the guided visit, the needs of the health facility are listed, especially those whose solutions depend on the capacities and the resources of community members. A reminder is given, and they talk about the concerns identified during the community dialogue, and then together the participants can prioritize 5 or 10 actions. And these are actions that they can carry out themselves. Everyone agrees that these actions will enable them to rise to the challenges linked to the supply and the use of services. Once the community has identified these actions, volunteers can put themselves forward, whether as individuals or as part of an association, and they will choose the actions that they wish to carry out to help improve access to services. A follow-up committee has been set up. This committee has several responsibilities. This group ensures that there is follow-up to important discussions. The service providers can also be a part of this follow-up or monitoring committee. As you see here in this picture, they are the first to benefit from the community actions that are carried out together with the populations. Information sharing and transparency in the actions of the monitoring committee contribute to social accountability, and that encourages even more active participation in all of this process. Next slide. So as you can see in this photo, with the support of the project, these community engagement actions have helped to mobilize community networks and potential customers. Together with the health managers, they have contributed to carrying out several actions that have been beneficial to the entire population. This includes, among others, rehabilitation of health facilities, donating medical supplies and equipment, drilling water wells, organizing educational activities, and promoting the use of family planning services. And that's not everything. The list goes on. So that's what I can tell you about WABA's experience of community engagement in the 4 project countries. Now, what's next? I am pleased to introduce our partner from Togo's Ministry of Health, who will be sharing her experience of community engagement. Ms. José Apeke is the focal point for reproductive health and family planning in the Blita Health District, which is in Togo. She has participated in Breakthrough Action's community engagement activities in this district. In Togo, as I was saying, as in most everywhere in the 4 project countries, project partners have adopted the approach and they have taken actions themselves. So she is going to talk to us about some of the achievements that we have been able to reach together in Togo. And now I'd like to hand the floor to Ms. José Apeke. Thank you very much. Thank you, Hilaire. It's truly a pleasure for me to share my experience of community engagement activities with you. I was first introduced to WABA's community engagement activities in 2021. At that time, I received training in the organization of community dialogue and guided site visits. Since then, I have been involved in a number of these activities with the support of WABA. What is interesting about these community engagement approaches for healthcare workers is that when you take part in these activities, you are able to get in touch with populations and have open discussions with them. It also enables the community to understand the difficulties we encounter on a daily basis in providing health services. From there, once the link is established, communication becomes easier. We build trust, and all of this enables us to work together for actions that will benefit the community. In addition to the activities that we've carried out with the support of the WABA project, we have been able to carry out a number of projects using our own resources. And I'd like to talk to you about some of those projects. On this side, you can see a woman who is in charge of a women's group. They took part in a community dialogue and a guided site visit, and she mobilized members of her association to organize information sessions on family planning. At the end of these sessions, they go to the health facility for an interview. And here you can see the organization of a community dialogue on the initiative of the Sangera leader, who is asking a health worker to hold monthly discussions on family planning with his community. And with this slide, you can see the construction of a new maternity ward. This need arose after a guided visit of the healthcare facility. The traditional leaders working with the COGES held meetings with the community members, leaders, and executives in order to mobilize the funds to build and equip this maternity ward. It is going to allow the room that exists to be used for FP services. So here's just a few examples of what we have been able to do with our communities. And now I'll hand the floor back to the moderator for the next part of the webinar. Hilaire, to you. Thank you so much, José, for for your presentation. It is wonderful to see all that the communities have undertaken. Now, I'm excited to introduce my colleagues who will be sharing their country's experiences in community engagement. So we'll start with Cameroon. Our speaker is Ms. Valerie William Auma Etamba. Valerie is a senior program officer and a PMI coordinator at Breakthrough Action Cameroon. She has 12 years of experience, and she has worked on social and behavior change communication projects in the fields of malaria, HIV, cholera, diarrhea, tuberculosis, and others. Thank you so much for being with us today, Valerie, to share the experience of Cameroon. Thank you, Hilaire. Thank you for giving me the floor. I'm looking forward to sharing our experience in Cameroon with you today. I'd like to explain how the active involvement of traditional leaders in community health activities has helped to increase household interest in listening to health messages as part of community dialogues. We have put into place a 4-pillar approach. The first pillar is based on the diagnosis of problems leading to the joint creation of solutions between healthcare professionals and traditional leaders. The second pillar is the use of traditional leaders' authority as a guarantee of household commitment. Third pillar, the empowerment and technical supervision of community health workers by the health services. And finally, the fourth pillar is using the traditional community site as a center for disseminating health messages. This empathetic approach has produced spectacular results in terms of community engagement in our country. Next slide. So I'm going to present some of the results, some of the more striking results of our approach. We noticed that traditional leaders themselves will preside over community dialogues. They invite households to participate, which encourages greater participation of households. We have also noted women's interest in dialogues, which led to the establishment of women-specific sessions so that they could express themselves more easily. This approach has significantly improved and strengthened the ties between healthcare professionals and communities. The giving soaps and other care products to traditional leaders for use by participants in the community dialogue has also allowed us to highlight the effects of empathy on community engagement when, and particularly in working with households themselves, in seeking solutions to healthcare problems.
It is now my pleasure to give the floor to my colleague from Côte d'Ivoire, Mr. Benjamin Soro, who specializes in communication for social and behavioral change. And he's currently the Deputy Director for the Breakthrough Action Project in Côte d'Ivoire. Benji is going to talk to us about the experiences with community engagement through women's group. Benji, you have the floor. Thank you very much, Valerie. As you indicated, I'm going to talk about the experience in Côte d'Ivoire and the intervention of women's groups, which is one of the approaches of community intervention that we use for Breakthrough Action Project, particularly on the anti-malaria program. This intervention aims at working together with women's groups or association as a sort of a community relay with groups and health facilities. They are existing groups which are publicly selected by the community in the presence of community leaders and administrative authorities. Each women's group selects 10 women that are mobilized, who are referred to as focal points, and that are trained on following up on essential family practices, essential family care. Each focal point must visit the home of 3 women of their neighborhood during a month in order to exchange on essential care. And they make sure that these key family care practices are properly implemented. And if not, they carry out a chat with the women to make sure that they know about it. They also look at lost pregnant women following prenatal consultation together with the group. So there is a sort of complicity that establishes itself between the women and the agents. I'm going to show you a video that is going to show you one of the focal points speaking and expressing how she feels and what the community feels towards her. Here is the video. Thank you very much. This was an excerpt from an amateur video recorded in the field during a visit of PMI USAID. The video itself is a little longer. She says a lot of interesting things. The lady is Emilienne Assou. She's the focal point for a women's group in the Bruak Pahusu village. Essentially, what she says was that the work was not easy at first, but after persevering, the community members finally understood the importance of their work. They are highly appreciated by the village people. And for this is a gratification element that is more important than money. So from the very mouth of this lady, we see the importance of community engagement. The approach of women's group is spreading and getting imitations in many health districts. The approach deals with a number of problems: strengthening communities' capacities, the development of empathy between service provider and women in the community, and the question of ownership and durability. Success indications of this intervention, what are they? Focal points are very close to the community because they reach out directly to the women in their neighborhood. It is the women from their neighborhoods that they work with, the women they know, the women whose language they speak. The focal points of female groups are so appreciated by the community and within the community that this gives them a strong moral satisfaction, which pushes them to continue working even though they don't have much financial needs. Most of them have become sort of godmothers for the young women that they follow and support. So they really became a reference for these women. And then there is the legitimacy of female groups, which is also a factor guaranteeing the success of the intervention. As I said earlier, they are selected within the community, in public, in the presence of community and administrative leaders. And then there is a strengthened empathy from the women, who allows for an increased cooperation with community women, which in positively influences attendance to the health center. This is what I wanted to say to you today. Here is my colleague from Niger, Souley Abdul-Taziz Tanko, the field coordinator in Niger. Abdulaziz is going to talk to us about the action cycle for the community, which is a process used in many countries, in many health districts, in order to systematically identify health needs. Abdulaziz, thank you for giving us some of your time and sharing your experiences with her. And our best wishes given the difficult situation in the country currently, and we wish the very best to the people of Niger and to our friend and brother. Thank you, Benjamin. Thank you for giving me the opportunity to present the WABA experience in the implementation of community engagement in Niger. My intervention is going to focus on 2 points. First of all, the presentation of the approach we implemented in Niger, and second, the results and indicators of success of the approach. In Niger, the WABA project has implemented the simplified approach of the community action cycle, or more specifically, the community dialogues and guided visits, which is the third of the 7 steps of implementation of the community action cycle. The process of implementation of WABA with guided visits and community dialogues more or less followed the different stages of the CCA, and we have started by setting up and intensifying community mobilization, multidisciplinary teams, then organize a series of briefings for the stakeholders. And then there were village meetings that were organized by health agents and health committees in order to inform the committees and the communities of the selection of the sites. The community dialogues and guided visits involved the leader in the health field, the committee leaders, the community leaders, women, authorities, all were organized in order to identify the possible challenges to the use of reproductive health and family planning services. Clearly, following the elaboration of community action plans, those have to be implemented. So the health committee have implemented these plans, which allows several realizations, as we will see in the results. And then there is a quarterly follow-up that is organized in order to see what the implementation gave, what were the challenges met, and offer solution. As far as the results, we have selected a number of results and lessons by audience. If we've selected different various group men who are now informed enough on the importance of prenatal consultations, assisted birthing and family planning through the guided site visits. Here is an example of a woman who is presenting the package of interventions and following the visits. Men were really quite grateful, and they've committed to relay the information to the other fathers and made the commitment to facilitate access to the services by the women. As far as the women were concerned, we saw that the dialogue within the couple was more accepted, particularly when it came to issues of health. Thanks all this to the community dialogues. Women felt appreciated because they were able to speak before the men. And these very same men recognize that they do not support the wives, the women sufficiently. So the community mobilization, multidisciplinary teams duplicate the approach in their sector, given the most satisfactory result of the approaches. Then we have the health leaders in some districts, given the results, they have reproduced the approaches as well as in other venues. And as far as the indicators are concerned, why was the approach successful? here are a few of the success indicators. Implication and commitment of religious leaders. As I said, they've facilitate the elimination of obstacles to the use of services, because before there was a poor interpretation of religious concept. So they organized a number of meetings to promote good health through action plans. And this made it easier for community to get involved. There is also an implication of administrative authorities that gave credit to the community action groups. The communities therefore felt more trusting towards the approaches in the regular feedbacks from health authorities at every level. The leaders were able to really receive a lot of information, including on the problems that existed and that they didn't know before. So thanks to the community dialogues, there was an improvement of social responsibility of leaders, which gave back to community. And thanks to this transparency, they acquired the trust of the population. That's what I wanted to say about Niger. Thank you. And now that we have shared together this global perspective of the approaches, we are going to move to the question and answer session that will be facilitated by Dr. Telesphore Caboret, Senior Advisor in Community Health for Breakthrough Action and Save the Children International. Dr. Caboret has 30 years experience in the field of mobilization and in community engagement, of training, management of health programs based in communities. Thank you so much, Abdulaziz. Greetings, one and all. Hello, good morning, good afternoon, good evening, depending on where you are and joining this call from. So it is a pleasure for me to facilitate this discussion, just about 10 minutes. The first question to which I would ask for answers are, what are in your personal experience, according to what you've just heard, what are the indicators that that show that the community is really to take over following the closing of the projects? In other words, what are the indications, the signs that show that, as far as the projects on which you work, communities are really ready to take over? If you have any proposals of responses, please open your microphone and you can speak. Thank you, Telesphore. I think it is first for us presenters, this question, given the experiences we experienced in the countries themselves. And then if other participants wish to answer, then we'll give them the floor. Yes, indeed. Talking about our experience, what I can tell you is that the experience in Togo, presented by Madame José Apeke, in terms of ownership of the approach and in terms of accomplishments undertaken by the communities themselves. This is just the example of Togo, of course, but I think it could be duplicated if we had enough time to show how the in other countries of breakthrough action WABA, this happened in Côte d'Ivoire, Niger, in Togo. We could have given the floor to other stakeholders that would have showed what they are doing beyond the support of the project. So in terms of, or as actors of the project, we feel reassured given these examples that show that things are happening and people have taken ownership of the approaches, and some accomplishments show that we've gone beyond what was done. And I would like quickly to close with the example of Blita, which is a community commitment approach and a community dialogue example that was presented to UNICEF in the context of the COVID vaccination process, and the UNICEF is ready to support them for their activities. It is the same for other fields, other sectors of the health field. This is an approach that is being implemented. That's what I wanted to say regarding the WABA project in our area.
Thank you very much, Hilaire. Another panelist. Yes, please. Benji, please go ahead. In addition to what I already said and what Hilaire has said as well, I would like to highlight the importance of the idea of legitimacy of the work within the community. When the problems were selected with the community's involvement, that moves things forward quite quickly. Another thing that I found interesting in the women's group's approach is the adoption of this action model. When the organization factor is difficult, people have trouble implementing it, but the approach was simplified. It meant that one woman, one focal point, only had to work with three or reach out to three women in her neighborhood. And so that made it much easier to do, much easier to put together these women's groups. And women could see how useful this was for their communities as well. And healthcare providers also were able to use their empathy, and that empathy on the provider's part also played an important role. Thank you. Thank you, Benji. I would like to add that in Niger, we worked with existing multidisciplinary teams, and we were able to work with them in their role, and they oversaw the sustainability of our approaches. We also worked on implementing community action plans, and we received support for mobilization and capacity building. So we think that with the team that we were able to develop from that, we can work towards making these approaches much more sustainable. I would like to respond to a question that was asked of me directly. We wanted to know if community healthcare workers contributed to community engagement in Cameroon. With regards to the engagement, truly the technicians are the foundation of this community engagement. They were able to share information about the community dialogue. They represented the bridge between the community and the healthcare services. So these were technical focal points who were able to use their skills to contribute to and to organize different community dialogues on different topics. So these community health workers represented a bridge between healthcare, like the healthcare facilities, and the community members. Hello, yes, please go ahead. Thank you very much. My name is Mr. Kaila, and I work with WABA in my community, and it has helped us a great deal with resource mobilization. We have been able to work with community groups in order to educate the members of our community. We were able to train them in resource mobilization. And we were also able to organize different forums in order to encourage information exchange in Togo and with other countries. This is a very interesting approach for us. and it took into account the work that the population has already started. And so we were able to then mobilize resources in order to improve service quality and access to services. I just wanted to provide this account of how it worked in our community. Thank you very much. Thank you very much, Tedesco. How are you doing today? I'm doing well. I am so happy to see all of these questions. And I think that this question really represents one of the big challenges for us. What are the indicators? What are the signs that a community is ready to take control at the end of a project? I have worked with technical experts in SBC, and one of the indicators that we have noted is when we work with a community engagement approach, we observe that the community itself doesn't necessarily know what its health needs are. So we start there. Then with the guided visits, really contribute to giving the project direction. And then the community members will get some explanation of what the needs are, of what the services are. They're able to better identify the obstacles then. And then they can encourage pregnant women to go to their antenatal consultations. And in Mali, I know that this has effects on global health. Within our community, it has implications for health in general. We can also, I know that the health facilities will provide reports to the community. And this, I think, is one of the indicators that the community is ready to take over. It's when you have this communication between the health facilities and the community members. The community engagement approach is such an important approach. It is without compare in getting results. The community has so much to share, and it has a lot of knowledge. And I am convinced that we need to work with the community. We need to involve the community in all the discussions, in all the decisions, and that is what is going to ensure the longevity of a program. Thank you very much to all of the speakers, and thank you for letting me speak. Thank you very much, Bokum. Thank you. So is there anyone else who would like to speak? Cabri, Ellie? Oh, I see there are lots of people with their hands raised. Please go ahead, Ellie Cabri, après Catherine Sier. So please just 1 minute each. I'm so happy to get the chance to speak here. And I would like to respond to the question that you have asked with regards to the indicators and signs that a community is ready. I have worked with Breakthrough Action in Burkina Faso. And to respond to the question, I would say that the community's participation, in particular with regards to mobilization for project achievement, is a good sign. When the project, when you see that there's a very strong mobilization on the community side to work for these projects, then you can see that the community is very much involved. They have the ability to get organized and to contribute to achieving these goals. I think we have lost Ellie. Catherine, see Catherine. Can you hear me? Yes, we can hear you. Ellie, we've passed the floor to Catherine. Thank you very much. This has been so interesting. I have a question. Do we have any indicators to better measure community engagement? When we have community dialogues, the idea is that it is traditional leaders who are going to preside over these meetings. And is there training for them to talk about specific topics, in particular with dialogues? Sometimes there are topics that come up that have not been specifically trained. If you allow me, I would like to respond to some of the questions in the chat, and also we can move on. Thank you very much. Yeah, would you like us to go on and then you can write answers in the chat? Yes, that's what I'm suggesting. That sounds great. Thank you so much. Thank you for all of your rich contributions. Thank you for responding to the question with regards to indicators. Thank you to the panelists. Thank you to the participants. Thank you, Dr. Chagasu. I think it is important to note that to guarantee the longevity and the sustainability of a program is to recognize the legitimacy of the group that we are working with, and to make sure that the tasks and the actions are simplified so that we can hand these off to the different groups and community members. It is also important to create ties with the different maternity wards and healthcare facilities. That is important to ensure longevity as well. There's also the question of empathy on the side of the providers. I would also like to come back to the question of empathy. When we're looking at community health workers, when we're looking at healthcare providers, I think it is important to take into account the general population's emotions and feelings. This is an important opportunity to make these changes in these programs sustainable. Working with multi-sectoral community teams is also an indicator. Sometimes issues related to healthcare may seem abstract. And there's always a need for connection between the healthcare system and the community system at the individual level, at the district level, at the community level. All of this is very important. So it is important that the community is able to develop an operational plan, an implementation plan for the healthcare facility. I would also like to take a moment to recognize what my colleague from Togo said when he mentioned that the main indicator for continuity starts with when we have noticed that there is a culture of collective action. Even if there are some mistakes that are made, from the moment that we see that there is a culture of collective action, once that culture has been established and everyone enjoys participating in this, when everyone comes together to act collectively to resolve an issue, that is when we have really good indicators. Once we see the the creation and development of this culture, then that is when we know that the program has become sustainable. Perhaps how can we work on this culture? How can we create a culture of accountability, a culture of collective action? Because in the end, we need to make sure that good governance is established at the community level also. But how can we encourage a social and behavioral change in order to create this culture and support FPRH services?
There are a number of other resources that you can have access to in terms of community engagement. We have a community engagement class, a course on reproductive health and family planning, which is starting today, available in English and in French at the Learning Center of Breakthrough Action. We'd like to also invite you to continue the discussion on the Springboard. The link appears on the slide on the screen. So please make a note. We would be delighted to continue our discussion with you through the Springboard. I would like to also let you know that WABA organizes another webinar on this series. It is part of the series of 3. Two, or one happened. The second one was today. The next one will be on September 27 at 2 p.m. GMT. And we will present our activities on mass media, social media, and interpersonal communication to ensure a direct and candid communication with young people on reproductive health and family planning. So see you on September 27th. I would also like all those that have been a part of this webinar to answer the questions of the poll. Take 1 more minute, and that will help us improve even further for next time. Thank you for your time. I think you should see the poll on your screen now with the question. May I ask you to take a second to answer? So thank you very much, one and all. I hope you had the time to answer the questions in the poll. Allow me to take this opportunity to thank you very much again for your interest in community engagement. You're going to say that I am preaching in my favor, but I think a great number of issues in development are linked to the involvement of communities to all development issues in any field, whether it's health or otherwise. So I think we cannot move forward in a significant fashion as long as we are, and regardless of the scale, if we're not a community ready to take charge of the various challenges that we encounter. So I would like to give you one more quote, if I may. Anything that is done with the participation of all is more likely to be lasting. So people own what they have contributed to create rather than what has been imposed to them. So I think we need to take into account the fact that we mobilize people only on the basis of their interest. We need to mobilize people based on what is important for them. So thank you again. We remain available through various platforms, including the Springboard platform, to continue our discussion. I wish you all a good afternoon, evening, depending on where you are. And it was a great pleasure for me to be here with you. And I thank you again for your participation. Thank you and farewell. Goodbye. Bye-bye. See you next time.